Welcome. Gonna give for one more minute for more people to join, and then we'll get started. All right, let's go ahead and get started. Welcome, everyone. Happy Thursday. Hope you are enjoying this fall weather. Welcome to Aparo's Nonprofit Bites and Insights. Today, we are going to be talking about some case management tools. Now, if you're looking for a tool to track your programs, track your clients, participants, and pull reports, you are in the right spot. So we have two vendors with us today, Collaborate and Apricot. We are giving them 20 minutes to do a high-level demo on their tool. We'll also leave 10 minutes at the end for a Q&A. Some housekeeping items. Yes, this webinar is being recorded and will be added to our Aparo website. All of you who are attending will receive a follow-up email from me that includes a link to the recording, letting you know that it's ready, as well as any slide decks or resources that our vendors would like to share with you. At the bottom here, this is what your toolbar should look like. There is a chat box available for you to use to make any comments or questions. If you prefer to drop in your questions at the Q&A, that's fine too. We will be monitoring both. And then finally, if you'd like to use closed captioning, that is available as well. So before I turn it over to our first vendor, I'd like to share a little bit about Aparo. Aparo is a nonprofit that helps other nonprofits in the areas of technology and business processes. And we do this by connecting you with a skilled volunteer in the areas of advice, education, and solutions. So really quickly, typically new nonprofits will come through our services meeting with a tech therapist. So you meet one-on-one to discuss a technology need or challenge, get coaching, get guidance, or getting connected with a vetted vendor or resources. Under education, if you'd like a team training or workshop for your nonprofit, we offer that as well. And then finally, under our solutions, we have what we call our community impact projects, which are more in-depth, longer-term projects to help ensure that you have the right solutions to your technology need. So for example, if you'd like to develop a technology plan or business process analysis, we have volunteers who are ready to do that. Maybe something more relevant for our conversation is we also have an application selection project. So if you're looking for a case management tool, we can connect you with a volunteer or a team of volunteers to help make sure you're making the right choice for your organization. Here are a few ways to get connected with us if you aren't already. You can visit our website at aparo.org/nonprofits to learn more. Or you can submit a request if or when you are ready to get some help. You can also subscribe to our email list, or you can email me directly and I'd be happy to direct you in the right place. And then finally, if you like what we do at Aparo, please consider writing a short Google review. The QR code is available for you to use. That is it for me. I'm going to stop sharing. We have Tom Reese from Collaborate here with us and Jill Guffey from Apricot. Tom will be going first, so I am going to go ahead and turn it over to you, Tom.
All right, thanks a lot, Yenting. Great to be here with everyone today. I'm Tom Reese. I'm the content manager here on the Collaborate team. And I'm going to go ahead and share my screen, go through a brief introduction, a little bit about Collaborate and about Network Ninja as well, which is the company that I work for. And then we will dive right into the demo. So can you folks see my screen okay? Good. All right, awesome. So again, I'll be demonstrating Collaborate case management software and how it's used by hundreds of nonprofits. We like to say if you chose Collaborate as your case management solution, you'd be joining a community that's dedicated to better serving people with technology. So again, Collaborate is a case management system. This is developed by Network Ninja. That's the company that I work for. We're a fully remote software firm established way back in 1998. We have over 60 specialized employees that include software developers, business analysts, support staff, and even social workers. So we've been consistently hiring from within our client base over the last several years, bring the specialized knowledge of what you folks do in-house, and that's aimed at helping folks get the most out of Collaborate that they possibly can. And we've been working with social services, nonprofits that provide social services specifically for over 20 years. So why work with us? Why work with Network Ninja and Collaborate software over some of our competitors? First and foremost, we're a privately held company. We have no investors. We're not owned by a venture capital firm or private equity firm that exists only to enrich already wealthy people. We have no investors. We're privately held, which means we are 100% customer focused. So we are all about you and your needs, not on investors. We've also got a 5.0 rating on Glassdoor. That is an employer review site if you're not familiar with it. This reflects our very low employee turnover, and that equates to long-term relationships, not just internally with our employees, but with our customers as well. We really pride ourselves on that. What that means for you is if you chose Collaborate as your case management system, in all likelihood, your account manager would be your account manager for years and years. And you'd have that long-term relationship with people. We get to know you, you get to know us. We also have a huge focus on security and compliance. We get asked about things like this all the time. We're HIPAA compliant, we're SOC 2 Type 2 compliant, also an Amazon Web Services public sector partner. What that means for you folks is we have invested really heavily in protecting your sensitive data. So who uses Collaborate? Some quick examples here. Nonprofits that work with families, children, and seniors primarily. These include organizations like victim services organizations, even statewide networks of those organizations and coalitions of those programs. Family services programs, at-risk youth programs, municipal agencies, even like general assistance and veteran services. Hundreds of different types of organizations that serve children, families, and individuals use Collaborate to handle their entire operations. So everything from intakes and services through outcomes and reporting. Best part about Collaborate, in my opinion, is that it is configured for you. That means our analysts and developers will work with you to tailor the software to meet your precise needs. This includes things like streamlining, standardizing your intakes, recording comprehensive services, tracking data across multiple programs, even across entire statewide networks of programs. And those always complex funder reports, we really specialize in those as well. This all rolls up into, for you, easy setup, fast onboarding without a lot of heavy lifting on your end, and custom development available too. So we are a custom software developer. So we develop custom solutions like data integrations or specialized functionality specifically for specific organizations that use Collaborate. We do that each and every day. We also have a huge focus on training and support. So as a Collaborate customer, you would get in-app support, which I'll show you in a minute. You also get a free one-on-one reports consultation each month in which we would guide you to tweaking reports you already have. Sometimes we will just create new reports for you and walk you through the processes of doing those things yourself as well. We also have live training webinars each and every week that are totally free for all Collaborate users to join. On-demand trainings as well, so recorded trainings that cover a variety of topics, pretty much everything that you can do with the software. You can find an on-demand training for it. Also have a detailed knowledge base, so text-based and image-based articles that you can access and search through. And finally, even a concierge service, which is a premium support service in which we can essentially act as your data administrator for you if you so chose. Collaborate also features one-click funder reports, which I'll be showing off in a little bit. Really is as easy as clicking the name of the report, clicking the reporting period you want to run it in, and clicking Run Report, and then it outputs this data in the exact format that your funder requires it in. We also have data migration expertise in-house, so if you're leaving a legacy database, that's no problem. We've got a dedicated team for that. And we've successfully migrated hundreds of organizations, including millions and millions of records, into Collaborate. Quick thanks as I get started here today. We're really excited about the opportunity to be here in front of you folks today. We work in this space because we support and believe in your mission of helping people and being able to do our part by developing software that empowers social workers and other helpers. That's what motivates us. Now let's go on with the demo. I'm going to be showing you a testing site, a stage site. There's no real data on this site. We use it for demo purposes. And I have an administrator account, so I can do absolutely everything on this site. Most of your frontline staff will have much more lockdown roles and permissions, though. So here is what my Collaborate home screen looks like. Everything in Collaborate can be customized or configured for you for your precise needs, but this is pretty standard. I've got my case assignments up top, so cases that have been assigned to me. I've got tasks here that have been assigned to me. I am an administrator, so I can also see all users' tasks if I want to. And finally, at the bottom, I've got recent cases I've accessed. So this is a nice little handy shortcut if I've been working with someone, but I can't quite remember their name. I could always find all my recent cases right there. Also want to point out this orange help button here. This is your ticket to on-demand help within the application whenever you need it. And this is contextual help based upon where you're at currently in the application. So you can see I am on the home tab here, so I'm getting up served home tab help. I can also search for help if I need help with reports or something like that. I can really easily find a lot of reports articles. And if I'm stuck, I can always submit a support request from right within the application as well. I need reports help. I can send that off now to the Network Ninja team, the Collaborate team, and get help turned around really, really quickly. Really pride ourselves on quick turnaround to your support tickets as they come in. So that covers the home screen and how I can get help within the application whenever I'm there. I want to give you now a quick overview of intakes in Collaborate. So a new client has come into your organization. You need to do an intake. You have multiple types of intakes that we can create for you in Collaborate. I'm going to show you one of them really quickly, just creating a new client. When I create a new client in Collaborate, I have to do what is called a conflict check. This will be searching for matches throughout the system, not just in my site as well. If you're part of a larger organization where you have multiple programs, it can search across all those programs. It can also search across an entire statewide network of organizations. So it's doing some sophisticated matching behind the scenes. It's giving me a score of these matches. These are all different Lisa Simpsons. The date of birth doesn't match. So let's go ahead and create a new intake for Lisa. These are my quick intake fields now. Again, these are infinitely customizable as well for you. I'll go ahead and save and edit Lisa's case. She's been entered into the system now. I could leave Collaborate, come back, pick up right where I left off. Her case record with a unique case ID has already been created now here for me. These folks have a very lengthy intake. Definitely don't have time to go through all this, but gives you an idea of what's possible. You can have multiple pages in your intake forms to gather things like demographics, education and employment, health and medications, and so on each page of your intake. Again, I won't go through this entire intake. Definitely don't have time for that today. But also want to point out, you've got a lot of different case actions that you can complete here as well. I can add new relationships for Lisa. I could add mom and dad and brother in here really easily, really quickly, that get their cases kicked off too. Supports very complex familial relationships. I can also do a lot of other actions on this case here. I can add case notes. I can manage documents, including electronic signatures. I can assign this case to myself or to someone else. I can create new tasks, so to-dos around this case. I can also set up alerts. I could restrict this case, really lock it down so that only certain people can view it. I can also view an entire audit log for this case. So everything that's ever been done to this case, who did it, when they did it, what fields were changed, et cetera, which is really important for a lot of organizations to have that audit ability. So that quickly covers creating cases, all the options you have once you have created a case. Now I want to show you services in Collaborate. So you've got two different types of services in Collaborate. One would be simple services. These are all pretty much the same. You're just the who, what, where, and when of when this service took place. You can add a service provider, start time, end time, etc. You can add an optional service note as well. So these are simple services. They're all the same. You have full control to customize these yourself, but they really only differ in name only. Also wanted to show off if you find yourself having to record multiple services at once. We have a feature called Quick Batch Simple Services. So I can record many services for this client here, Lisa Simpson, very, very quickly. I can many of these and process all these services in one batch. So this is really helpful if you find yourself after intake having to do a bunch of services, a big battery of services for clients all at once. Now, outside of simple services, we also have elaborate services. The sky is really the limit with these. You can have multi-page services, different types of steps to complete them. You can run them at different intervals and things. So these are completely customizable. I'll go ahead and show you one example. This is a back assessment, a clinical assessment that's built into Collaborate and also customizable for you. So I can add my T-score profile, add some observing information, different testing results. We can do things like automatic scoring in these clinical assessments and these elaborate services as well. So that covers intakes, services, different types of services that you can have and how they can be customized in Collaborate. Also wanted to, because I know time is short, run into everyone's favorite or least favorite topic, which is reports. So Collaborate is designed to make it very easy to input data into the system for your intakes and services, activities, things like that, but also to get it back out of the system in the form of reports. So I'm going to go ahead and drag over an example report here. This is a VOCA report, which is a victim services focused report. Very, very complex report that differs from state to state. I can run this across an entire statewide network of organizations or a single organization. Right here, let's just go ahead and run it for one organization. It really is that easy. I pick my fiscal year, what quarter, what sites I want to run it across, and the parts of the report. Collaborate outputs this report in the exact format that my funder requires it in. I've got all my population demographics, race and ethnicity, gender, et cetera, et cetera. For each section of this one-click report, I can show an explanation of what it takes to be counted within this section of the report. So here it's telling me it's got to be an individual that received a VOCA direct service in the reporting quarter. What is a VOCA direct service? Well, that is an elaborate or simple service with a VOCA mapping. So we can map your services to specific funder reports in Collaborate, and even your administrators have quite a bit of control over that as well. So that's one type of report in Collaborate, again, a one-click report that our business analysts and developers will work with you to create for you. We also have what we call dynamic reports. Dynamic reports, you can create them yourselves, or we can create them for you. So I'll show you an example of one here that one of our customers uses. This is an audit sort of report. So they want to find cases that have missing demographic information. They run this at the end, toward the end of each month. They see the caseworker here who needs to fill in missing demographic information. So if any of these columns are missing, they know that this caseworker needs to go in, fill that information in so that it can be properly reported on here at the end of the month. So this is just one example of a commonly used report in Collaborate. You can report on every field in the database, by the way, with Collaborate with these dynamic reports, and we do train you, your staff, to create them yourselves, or we can create these for you too. Another report I wanted to show you, another example is, this is an audit report that's showing the days between when a client's intake happened and their first service. In this case, a forensic interview service. But so days between client intake is completed and they receive their first service. And we've got this broken out in different cross tabs. So we're seeing discrepancies between different counties. We've created different buckets of day periods. So same day, 1 to 5 days, 6 to 13 days, or over 14 days. And we can see the different disparities here between county of residence. So are we helping people in a specific county a lot quicker than other counties? We've also got a cross tab here created in Collaborate that's showing discrepancies between biological sex. So are we getting services to people more quickly if they're female or if they're male? How are we treating ones where the biological sex is unknown or they prefer not to answer? And even by referral source as well. So how long is it taking us to deliver services after intake based upon referral source? So from law enforcement or for Division of Family Services, again, are we getting to people faster or sooner based upon that? You can also, within the reports module and Collaborate, create bar charts, pie charts, and line charts as well. So this is a pie chart showing the average time elapsed till our first service. You can see more than half of them is same day, and over 14 days is 20%, so kind of lagging behind there. And the similar information here presented in a bar chart. Again, we train you to create reports like these yourselves, or we can create them for you. And I know I'm running pretty short on time here, Yenting, so I'd like to pause if there are any questions or if there's any time left. I'd love to answer those.
There are 4 minutes left of your time.
Okay.
There hasn't been any questions that come through. So if there are questions, please drop them in now. In the meantime, pricing is always a question. So Tom, I don't know if you'd like to take this time to go over that.
Sure. So the pricing for Collaborate is pretty standard, but it depends on how many users you have, if you are single organization, or if you are a network. So the pricing varies based upon that, along with any optional modules that you might want to include in Collaborate. And if you're doing something like data migration from a previous system, all those things affect the price. So after an initial one-on-one call with you, I could put together a Collaborate pricing sheet for you that would give you a really good idea of what those costs are.
And we have a question that came through.
Sure.
How easy is it to integrate?
So it depends on the type of integration, but we've done all kinds of different integrations with outside software, with outside data sources. So it really depends on what you want to integrate, but we'd be happy to explore that with you. And yeah, it's generally pretty easy to do that.
What would you say is the time frame for implementing Collaborate? How long does it take to get everything set up and going?
Sure, yeah. We generally say anywhere from 3 to 6 months, depending on the complexity of your project. Some organizations choose to really take their time, and they say, we want to take a whole year to do this. Others say, we need this next month. And so we can accommodate that too. It will be a really compressed timeline to do things like gathering requirements and configuring the software to meet your needs and training your staff. But we can certainly meet a timeline of up to, I would say, 1 month if you really had to get started immediately with it.
Really quickly, I had a question that came up for myself. So you
Sure.
talked a lot about customization. Are those do it yourself, or if you want to make changes, do you have to go through Network Ninja to make any changes?
So it's both. It's both, really, Yenting. So your administrators have a great deal of configuration ability themselves. So things like populating lists of drop downs or checkboxes, those kinds of form elements. You can add a new gender identity or disable a gender identity within your forms and things like that. If it's more complex things like workflows, again, we would have you lean on us to do those. So we'd do some discovery, come up with some requirements for that, and then present, the cost of what it would take to do that. But most folks find that they can, manage the application themselves. And again, you can create all different kinds of reports yourself and things like that too.
Great. I don't know if you're familiar with Salesforce, but one of the questions is if they would have to choose from Salesforce, what would be the difference between Salesforce and Collaborate?
Well, Salesforce is a, I don't know, $200 billion company or something like that. I describe their product as a Swiss Army knife. It does a million different things, but it doesn't do any of them particularly well. Collaborate is purpose-built specifically for social services organizations and nonprofits. So it was built from the ground up to handle exactly what these folks do. It's off the shelf, available, ready to roll, ready to go. And our team understands exactly what they do and can help them every step of the way. And it's super cost effective too. If you were to build something like Collaborate using a Salesforce partner, it would probably cost hundreds of thousands, if not millions of dollars, to replicate what we've got here. Our cost is way lower than that. So those would be kind of the main differences. And again, Salesforce, publicly traded company, they care about their investors. That's their imperative. We're not like that. We're privately held. We care about our customers and our employees. That's it.
Great. Thank you so much, Tom.
Sure.
If there are more questions around Collaborate, we will have a Q&A at the end to address those. But right now, we're going to go ahead and switch it over to Apricot with Jill Guffey.
That's great. Thank you.
All right, let me go ahead and share my screen. Can you see my PowerPoint?
Yes.
Great. Thank you all so much for allowing me to take 25 minutes of your time today to discuss Apricot software from Social Solutions. Thank you to Abaro for having us. I'm Jill Guffey. I'm the director of our solution architecture team. So my team and I do all of the product demonstrations for customers like you that might come and talk to our sales representatives about how Social Solutions and Apricot software can fit into your tech ecosystem. Social Solutions has been around since the year 2000. I've been around 15 of those years. So I started off as a customer of Social Solutions for 7 years, and I enjoyed the product and the company so much, I decided I wanted to join the team. And so I've been an employee of Social Solutions, now Bonterra, if you've heard, for 9 years, so over 9 years now. So a lot of our employees come from the social goods space, so we understand the challenges and the goals that you have as an organization when implementing technology. We have 3,200 users, or 3,200 organizations using Apricot software, and that's about 120 active users daily. About 6,000 new individuals around the world are added to our software each day for nonprofit organizations like yourself to deliver services to them. And about 330,000 services are logged in our software every day. And when we did an independent study, we found that most of our customers are saving about 1,400 hours in reporting time every year. So no longer every month having to reinvent the wheel in spreadsheets or other tools that you might be using. How we can help is with our tool called Apricot, and there's different flavors of Apricot depending on your size and the types of services you're delivering. And so when you go to our website, there will be a chart there that describes our 3 flavors: Apricot Essentials, Core, and 360. It's all the same base product, and then each of those has different layers of feature sets that are built on top, 360 being our solution that encompasses all features. But when you purchase Apricot software, it will be a compliant solution. We are HIPAA, FERPA compliant. We have a SOC 2 audit, which is something that's needed on the security side. We're hosted securely with Amazon Web Services like Collaborate is as well. That's sort of the gold standard of places that you'd want to be hosted in. Why Apricot? Because Apricot can help you track outcomes. We were built 22 years ago because our founders worked in nonprofits and were not able to track the outcomes of the people that they were serving. So they built our first software and built our company from there. And today we have things like advanced reporting and analytics. And I'll even show you today how configurable our solution is so that after we implement the software with you, you can make changes to the software, like adding new forms and fields, creating new reports on your own. We also do have the connectivity that you're going to need to integrate with other solutions. And sometimes that means sending data to funders. And also it could mean integrating with other tool sets outside of Apricot. So we have many ways that we can integrate, whether that be exchange of data through Excel at a base level, pushing batches of data back and forth at some time interval, or an API, which allows our system to connect to other systems in real time. And this talks a little bit about those integrations. So with our comprehensive solution, you are able to make all of those exchanges with the other systems that are required of you from a funder perspective, but also from a productivity perspective as well. And some of the capabilities that I will show you today are some of our integrated features that makes the software really user-friendly and efficient for staff. We've built in a lot of tools so that they can stay within the Apricot tool and do things like schedule appointments, get alerts of things that they need to know about, track attendance very easily. And then we also do have security levels within the software to ensure that people are only seeing what's relevant to them, but also ensuring the security of your client's information as well. I'm going to go ahead and flip over to the software. Can you see Apricot now? I don't know if I shared my screen or the PowerPoint.
No, we can just see your slideshow.
Let me stop really quick. Sure. I told her, I'm like, I'm a pro. I know how to do this. Apparently not on the webinar version of Zoom. All right, here we go. So this is a look at Apricot software, and I'm logged into one of our demonstration sites that we've set up to show you the depth and breadth of what can happen within the Apricot solution. So within our tool, we have a structure called sites and programs. And so what this allows our customers to do is to have one or many sites within the software, and that could be a geographic location or a distinct set of services. And then underneath those sites, you can have many programs. So I have this comprehensive demo site that allows me to speak to any vertical of nonprofit organizations in a specific way that is helpful to them about the types of services that they're delivering. So you'll see here, we have customers across all of these continuums of nonprofit or human services. So just some of the different templates that we have in here. I'm going to today impersonate a user of the system called Adam, and he works in the adult case management space. So you'll see when I switch my role to Adam, which is also a neat feature that administrators of our software have, is that they can impersonate their staff and see what they see. So if they call and they're like, I can't do or I can't see, then administrators can go in and say, okay, let me act as Adam, go into Adam's access and see what's going on, which is kind of neat, but also neat from a demo perspective here. And you'll see on Adam's bulletin board, this is his homepage that helps him get started when he logs into the software. You can put alerts out there to deadlines or events that might be coming up. You can put quick links to different buttons to get him to different areas of the software quickly. But my favorite part is embedding relevant reports for Adam right in the homepage. And so each user can have different reports that show up here that are relevant for their role. So Adam's in charge of intake of new clients. So he might have a report on the homepage that shows, here's all the clients you need to follow up with and how many days they've been in this process, right? How many days have they been sitting waiting for that intake to happen? My next reports show me things like reminders of reassessments that I need to do and how many days I have to get them done. I love this feature. We have ways that you can auto trigger emailed alerts in the system and you can have pop-up alerts. But my favorite way to notify staff is these reports that count up or count down at them every day. So you'll see my top reminder there. Roman should have had his assessment 5 days ago, right? So very glaringly like I'm behind. And these will increment or decrease every day. So tomorrow it's going to say -6 days and the next person down is going to say 23 days, right? So it just sticks until I do something about it. You can see I have some pending referrals that I need to keep an eye on to make sure that they went to the food bank or got the shelter they needed or, whatever that service is that I've referred them out for to make sure that we're doing that on time. And the big thing about Apricot and about social solutions is being able to track impact and outcome. So when we're implementing the software with you and your team, we're going to ask that question. What are the outcomes that you're trying to track? What's the impact that you're hoping to have on your community? Let's make sure that when we set up the software together that we're measuring that and we're giving that back to staff. A lot of times people say, and I was on a webinar last week, and somebody said, well, if I bring in some new technology, the staff's going to hate me. And I was like, not always, right? It really depends on the tool and if it's set up well, and what are you giving back to them? And this is what I found with my staff as I was implementing this software was I had to make it really relevant. I had to give them something back. And so by giving them graphs where they could see aggregate progress of our clients over time, they were able to see their impact. When I was able to give them graphs, and this is an example of an individual over here, this is Roman, of his score over time, he's able to sit down with Roman and now say, look at the progress you're making. Look at the visual of the progress that you're making. And so that made a huge impact for them and the ways that they could deliver service. And they didn't hate us for implementing this new data collection tool. But the power of this tool gave us the ability to sit down on any day and print a report out for our constituents and our communities, like our legislators and our senators, and say, this is how we're impacting your community members today. This is how many people are waiting for our services today because we don't have enough funding. And prior to implementing a software like ours, we weren't able to say that every day. We were able to say that twice a year. I created a report twice a year that said, here's the impact, here's the risk factors, we call it, of the people that are waiting for our services. We also have tools on the software that allow us to see things like geographic impact. And so you can create reports like this that show pinpoints of individuals that are receiving services in the community, as well as heat maps, where you can see heat maps of distribution of pockets of clients that you're serving in the community. This is also helpful to see where you're not serving people. So you can drill into your service area and say, where are those neighborhoods that we were hoping to serve people that we're not really seeing pinpoints in, or a deeper color of impact in that section of our neighborhoods. So reporting is super important to us. It's super important to your staff, right? To be able to get that feedback. Another neat tool of our solution is that we can email reports on a frequency that makes sense. And so with our 360 tool, and I might have to stop and reshare again, I think. With our 360 tool, you can send out reports on a frequency that makes sense. So you can email out PDFs or Excel reports daily, weekly, monthly, to your administrative staff to say, or all staff to say, here's a dashboard of impact that we're having in our communities today. Here's what it looks like for the number of people that we've served this month, this quarter, this year. Here's the types of services we're delivering and the ages of the people that we're serving and the impact, the assessment scores down here over time. So are we seeing the trend lines move in the right direction, right? So reporting is important to ensure that we're all serving people very effectively. This report was actually created by one of our customers, and I loved it so much, he lets me share it. And they have 3 teams on their staff. They have social workers, nurse case managers, and health workers. And these are real life people. That's why I sort of whited out their names there. But you'll see these are referrals coming in and being assigned to each of their workers. And this isn't 121 people. It's like so many people with varying needs. So they might have checked 5 need boxes, right? And then how much or what % of those referrals have been resolved? And if they haven't, why not, right? And so you can see the different reasons why they haven't been able to resolve those referrals. But also as a team, they can sit down and say, what's our biggest barrier? And so when you can write a grant report or an ask for a grant that says, we need more home visitors because 20% of the time people are waiting for that initial home visit. When you have data to back up the ask, that's really effective in achieving new funding. But also they can see the reasons are different for each of these teams. For this nursing team, they don't have enough resources, and I'm not sure what those resources are, but they're not there. Lack of follow-up on this team, right? Their clients just aren't contacting them back. So really helpful reports at the aggregate level, but also this was huge for us, being able to sit down. We serve teenage girls, so being able to sit down with a teenage girl, or Adam here, and say, this is what your progress looks like over time. or this is what your lack of progress looks like in this time period. What can we do differently? Sometimes, and we taught our girls how we scaled these things out. And so, teaching them about regression and how to reset objectives to get them moving in the right direction was super powerful for us, right? But to be able to sit down with somebody and say, here's a look at your progress over time is super helpful. But then also at that team level, being able to sit down and see those averages. So what does it mean for us that there's this average dip at contact number 10? How do we insert an intervention at contact number 7 or 8 or 9 to ensure that we're not getting that dip again, right? So it's all about, good data in to tell a story, to change the impact and increase that over time, right? So a little bit about reporting there, my favorite part. So how does all that magic happen, right? So for every staff member, they'll have access to different, what we call record types over here. So you'll see Adam has access to, oh wait.
Jill, we can't see.
Oh, I told you I was really good at this. Hold on. Okay, there we go. So for every staff member, they have access to what we call different record types over here. So Adam can document about participants. Adam can group for participants into households. He has the ability to work with volunteers and assign them to participants. Sometimes he can work with referral organizations. He can work with job placement employers that might be partners of them to get their participants jobs, right? Every user can have different set of record types over here that they have access to. Data coming into the system can be from Adam entering that data in. We also have online intake form capability that you can put interest form or application on your website for people to fill in online. And when people fill out these forms, it can trigger an email back to them. Thank you for applying. Here's some resources that you can gain in the meantime until we contact you back, which will be in so many days or hours. They can also email somebody internally and say, you have a new referral that you need to pick up and get moving. So data can come in through online forms, through staff entering data, or through those integrations that I described before. If I click into the participant record, this takes me into my search area where I can look for someone that I'd like to serve. And you can search for someone by typing in a name there. I haven't put myself in my new database yet. Typing in a name and it'll filter down to that specific individual. You can also filter down by many things. So show me all of the people whose names started with an HARR who've enrolled in a specific program. And you'll see as soon as I pull my program enrollment box, it also lets me dig in and see which programs these individuals have been enrolled into, right? So you can search for things like name a person to get a specific person, or show me people who have started a program in a certain date range. So lots of ways to search and find information. If the individual doesn't exist, then it's a workflow process in the software. So we go and we enter in the new demographic information, we hit save and next and get to the next step of the process. And every screen in our software has this record save checklist. And the record save checklist tells me, what do I have to fill in before I can move to the next step of the process? What are my duplicate check fields? And you all can choose things like what your duplicate check fields are and how that works. And then also there's a merge tool that will merge records together in case you do end up with a duplicate, because sometimes people don't give us their legal name, or we get a nickname or something like that. So lots of ways to merge things together. We also have security at the field level. So say you do need to collect Social Security number for different grants, but not everybody needs access to that number. So you can set fields like Social Security number or other fields like diagnosis codes to be a secure field that only certain staff have access to. And our mailing address feature here is connected to Google Maps. And this is what allows us to create those neat pinpoint maps that I showed on the homepage, because it can go out there and find the address that that the person is living at, and it fills it in for you, plots it on a map, just saves staff a ton of time and effort. So I'm going to go ahead really quickly and fill in the rest of the demographic fields really quick right here. I'm not really paying attention to what I'm putting. I'm just trying to satisfy the requirements there, and save and next. And you'll see it'll pop up and say, what would you like to do? Would you like to stay here? view this person's folder, and that's where everything else is stored about someone that's not a basic demographic. And I like to think of this like, all those record types are different filing cabinets. And now in each filing cabinet, there's a bunch of folders or 3-ring binders, right? And all their documentation goes in the folder. So if you are coming from paper, bulletin boards, folders, face sheets, like staff know what those things are. But I'm going to do this Arizona Matrix self-sufficiency adult workflow just for example. And you'll see the software walks me through a set of tasks here. So task 2 is just to enroll somebody in to a specific site, put a start date in there. And that's going to get me my first output of how many people have we served, right? How many people have we served for how long? It's going to calculate a length of stay and all that good stuff. So you can report on that. And then my next step is to perform an assessment. So each of your organizations and programs probably have assessment tools you use to determine what people's needs are. The self-sufficiency matrix is just one of those widely used tools. We do have a template library with a lot of assessment tools built into it already. So more than likely, if you are using an assessment tool that's out there in the world, it's in the library already, especially if it has an acronym to it. So PHQ-9, ACEs, like GAD-7, all the ones that people just say the acronym for, most of them are there already. But this is one of my favorite ones, and it's generic enough that everybody can sort of understand what's going on here. And this screen, what I want you to pay attention to is this form logic rules box over here. Sorry, I'm trying to move it. It's not cooperating today. But right here, you'll see these form logic rules. And as I am clicking the answers to each of these questions, they're weighted on the background. So you'll see the little bubble spin down there. So basically, I'm just placing this person into a level of self-sufficiency based on the status of each of these questions. So they're weighted in the background. So this is just a general assessment of income and housing and food and childcare. Are there children in school? Those kind of things. It's a like 17 domain assessment tool that's really quick and easy. They're all formatted the same way. It's one of my favorites. If you're looking for a new assessment tool, you can Google Arizona Self-Sufficiency Matrix and get a PDF of this tool. But with our tools, what's nice is when I go and I enter in all of the answers to these questions, you'll see at the very bottom, I've set up a summary. So it says, here's the total score. This is what percent self-sufficient they are based on those scores. And currently, because that percentage is low, they're in this in crisis phase, right? So we're going to need to more extra touches, extra phone calls, whatever that might be, right? So it can provide a recommended level of self-sufficiency. And then you'll also see some recommendations down here. They have less than adequate employment. Let's refer them to our jobs program or to our neighbor agency. They're in need of temporary cash assistance. Let's make sure they can fill out those applications. They need food. Let's refer them to the food bank, right? Whatever those next steps are, those can be intelligently built into the solution with you so that staff just get that nice summary at the bottom. Sometimes these assessment tools are so long and you get to the end, you're like, now what, right? So the assessment tool can help with that. And then you'll see I've also built in a next step. I said, if housing is a need, we want to take care of that right away. And so what I've done here is pulled up the ability to refer them over to one of our housing organizations. So I can go in here and filter down to organizations that provide shelter. And that's going to filter down my list of organizations that provide shelter. And then I can refer them out to the organization that makes the most sense for them based on location or whatever that might be. You'll see it brings back here the contact information for that organization. And also, you can also set up email triggers in the software. So as soon as I hit save and next, it's going to email Andrea and let her know that I have somebody that needs to come over. It's going to email the client and say, here's the referral that I gave you today. And I want you to follow up with Andrea if you haven't heard from her. So it can auto start to communicate all those things for you. So great tools for that kind of thing. And then you just continue through the workflow, right? So super simple workflows in the software. And then everything culminates in the, what we call a folder. And so this is that quick look at the folder of, here's a program enrollment, here's that assessment, and what their status is. Anything else I have the ability to document is all here. So for instance, if I, want to record a service or want to document attendance in something or take another assessment, they're all right in here. And I just click the little plus paper sign over there to get into that form. So that's what it looks like from data entry. You do have tools to quickly enter lots of services for lots of people or lots of services for a person, things like that. I know I'm running out of time, so I do want to show you the administrator aspect of the software. So when I flip over to administrator here, you'll see my form designer. This is where I can set up the structure of Apricot. So if you're like, besides these sort of generic profile types we give you, you want to create a new record type, you can do that. So say you're like, we really need to track maintenance requests for our building. So people do that in our software. Track when somebody needs a window fixed. You can create a space for that. Or if I want to create something about a participant, I would just hover over that participant record. Sorry, my Zoom controls are on the way. And say, I want to create a new form from scratch, or I want to pull something in from that template library. So I say here, I'm going to do something from scratch. This gives me the ability to change the name of my form here at the top. And then I just start dragging and dropping the data elements into the form that I'd like to use. So if it's the date, maybe it's a Likert scale type question I need next, I just drag these over, and then you can set up things like lookup lists that allow you to easily put in things like a scale. So really easy to set up forms within the software where you can collect information, and we're going to teach you how to do that during implementation. Same thing for reports. So if I go to reports, create a new report, choose where I want to put it, give it a name, hit create. You'll see here I can dig in and pull in information into my report just as easily. So I can pull in the name of my participants. I could pull in some like program enrollment information over here as well, just by pulling in program enrolling, what site they're enrolled into, maybe their start date. And that gives me a list. And then from here, maybe I want to see a trend of enrollments. So this is my favorite part. You can turn a date into something really usable just by changing the label up there and then clicking a date style button. So this is also where I got those reminders of things that are coming up due or that are overdue. And then I can also group by that very simply. And then up here in the upper right hand corner, if I want to throw in a chart, I can do that too. So if I want to see a graph of that data, I can very easily put something visual to it as well. So you'll see I've got a big spike in October. And so we need to make sure we've got some extra manpower in that month, right? So decisions can be made easily here. And then the last thing I do want to show is we have that chat feature as well in our software. So you can chat with our support team here and they'll start to answer your questions. Or we also have the embedded help manual tool as well through here. So parity in our help there. And then we do have live telephone support, as well as you can choose to have what's called an advanced support consultant that you call by name. Hey, Jill, I'm having this problem, or Jill can check in on you and do health checks of your software for you as well. Any specific questions for me and Ting, or I can answer the ones that came in before I had that.
Yeah, I'm gonna go ahead and bring Tom back in. While I'm doing that, again,
Okay.
similar question to you about pricing with Apricot.
Yeah. While you're bringing them back in, so Apricot is a base per user. So it depends on how many users, what version of the software, Essentials, Core, 360, and then the length of contract. So it just varies by those three things. So level of feature set, number of users, length of contract.
Can you talk really quickly about the differences between those? You said Core, Essentials, something else?
Yeah, so it's just feature sets. So our Essentials is really meant for nonprofits that have less than 10 staff members. So it's got all the features of the core of Apricot, but it doesn't have like the online intake forms, the self-service portal, which I forgot to show. We also have text and email capabilities within the software. So just those extra productivity tools that are helpful. And then our core set has all of those productivity tools baked into it. And then our 360 has everything that core has plus the email reports that I showed, and a couple of extra features like clients are able to request appointments through their self-service portal, stuff like that.
Sounds good. To our audience, if you have any questions, please feel free to drop them in. We have about 5 minutes left with Jill and Tom. While you're doing that, a couple questions that came up for me. So Jill, you mentioned a lot about the email. Tom, feel free to jump in if Collaborate has the same kind of integration. But I was curious to see if you talked about emailing to different staff or to whomever, but are you able to send directly to clients as well? So if, say, for example, we have a program that's happening, I want to send to this batch of clients. Is that possible?
Yeah, you can set, there's a couple ways to email or even text message clients from our solution. So you can build rules in that say, anytime this box is checked or anytime they fill in a form for themselves, email them something. Or you can do manual, what we call connect direct messages, where you can go in and say, I want to send to these people. I want to type in the message I want to send. I also can attach an Apricot form. So I want them all to fill out the survey. And then you can send that out directly through the manual tool.
And would the survey answers go directly into Apricot? No manual entry, right?
No, it all comes back in. You could either have it connected directly to the client profile, and so it goes right in that folder where everything else is, or you can send out an anonymous survey too. So sometimes we like to send them anonymously so we get true answers or whatever. So you can do that as well.
Very cool.
And Collaborate has similar functionality regarding reminders for anything that you set up, be it tasks or upcoming service appointments. You can send email, SMS reminders for those to clients and staff. And yes, you can send surveys and collect data from those as well and Collaborate.
Nice. Yeah, I know it's a lot of manual work for a lot of smaller nonprofits. So I know they're probably excited to hear that feature.
Yeah.
Don't have any other questions that came in. Gonna leave it for one more minute, but any final comments or anything to share, either Tom or Joe?
Just a big thanks to you, Yenting, and to Aparo for putting this together. It was great being here in front of all these fine people today and getting a chance to show off Collaborate to them.
Thank you. Appreciate
Yeah, thanks so much. And ditto, and I enjoyed spending time with Tom too. So we're both great solutions. And so thank you so much for guiding nonprofits. I love what you all do and help them choose the right solution. So this has been great.
Absolutely. All right. Well, the final question is, if they're interested, what are best next steps?
They can go on our website and there's a request a demo button, and that will get you quickly to our team to do a more custom demo for you. And so that's the best way, or we can pass our contact information through your follow-ups.
Yep, same here. Just go to collaboratesoftware.com, poke around the website, or click the get a demo button. Very similar thing, and we will be sending some follow-up materials through Yenting.
All right, sounds good. Well, thank you both so much for spending time with us, sharing your tools. Really, really helpful. For everyone else, thank you for attending. And yes, I will be sending up the follow-up email by the end of the day tomorrow. And everyone have a great rest of the day. Take care.
Thanks so much.
Thanks, everyone. Have a good one.